Qapi, quality assurance, performance improvement. Quality assurance is a process of meeting quality standards and making sure that the care delivered meets acceptable standards. This means that a facility is in compliance with federal and state regulations. During annual and complaint surveys, facilities are evaluated to make sure that they are meeting the standards established by the regulatory agencies. Facilities that fail to meet standards can be cited and given an F tag, federal tags, or codes corresponding to regulations and/or rules. There are over 400 F tags that correspond to federal and state public health laws. The F tag is coded to reflect the scope and severity of the deficient practice. Facilities are required to respond to their statement of deficient with a plan of correction. This must be accepted by the Department of Health. Performance improvement is when a facility continuously examines their problems and makes plans to correct them. The problems are corrected using an organized approach of planning, doing, studying, and acting. Each problem is examined to determine the root cause. A plan of correction is to put into place based on changes in the system, are evaluated, and the data is analyzed to determine if an improvement has been made. Qapi has a vision statement, a mission statement, a Qapi statement, and guiding principles. The vision statement. The vision for Cold Spring Hills is to create a home-like environment where the individualized needs of all residents will be addressed by a competent, highly skilled, and compassionate staff. The mission statement. The staff of Cold Spring Hills are committed to enhancing the quality of life of each resident in order to achieve their optimal level of wellness. We will work at building meaningful relationships with our residents and their families through person-centered care. Qapi statement. The purpose of Qapi is to study, plan, analyze, and validate specific areas of improvement for positive resident care outcomes. This will allow us to realize our vision and carry out our mission statement. Our guiding principles. All staff will participate in Qapi. All residents and family members will have input and feedback from our Qapi process. We will use Qapi to make decisions and guide our day-to-day operations. We will set goals for performance and measure progress towards results. We will encourage our staff to support one another and be accountable for their own professional performance. We will research best practices and standards of care to ensure we are delivering the highest quality of care and services to our resident. We will use root cause analysis to identify specific areas to target and systems that need revision. Terms to know. PDSA cycle. Plan, do, study, act. We plan. After identifying the problem, make a plan objective to allow for improvement. Identify the root cause and plan the system changes. Plan how the results will be measured. Make a prediction about the results. Do. Carry out the plan. Share with all the staff, have formal and informal in-service, gather data to see if there have been improvements, collect and record the data. Study. Analyze the data, compare it to what was predicted, summarize what was learned. Act. What are new changes to be made? What areas need refocusing? What will be the next area of improvement? And then the root cause analysis. That's a process to identify what are the factors that are leading or causing a problem. There may be more than one, and the problem can only be solved by finding the root cause. Root cause analysis focuses on systems and processes, not in individuals. Summary of Qapi plan. A tool used to identify and correct quality deficiencies. A Qapi plan is the written plan containing the process that will guide the nursing home's efforts in assuring care and services are maintained at acceptable levels of performance and continually improved. An effective Qapi program is key to improve quality of life, quality of care, and services delivered to our residents. The facility is required to develop a Qapi plan and present its plan to federal and state surveyors at each annual recertification survey and upon request during any other survey, and to CMS upon request.